Why is muscular dystrophy diagnosis often delayed? Imagine noticing your child having trouble walking or climbing stairs, but thinking it's just normal for their age. That's often how muscular dystrophy symptoms first appear. Early signs of muscular dystrophy, like muscle weakness or delayed motor skills, can be very subtle. They are often mistaken for common childhood growth variations or minor health issues. Without a family history, doctors might not immediately think of muscular dystrophy. Many children with muscular dystrophy show signs around 2.5 years old, but the diagnosis can take nearly 2 more years on average. This means there is a long gap between noticing symptoms and confirming the condition. Getting diagnosed involves seeing different healthcare providers. If a child first visits a general doctor or a non-neurological specialist, they might not recognize the signs right away. This can lead to delays because these doctors may not suspect muscular dystrophy immediately. Once a doctor suspects muscle weakness, they usually order blood tests called creatine kinase tests. These tests check for muscle damage and can be elevated in muscular dystrophy. However, these tests are often done after symptoms have been present for some time, adding to the delay. Genetic testing is the most definitive way to diagnose muscular dystrophy. But it often happens only after other tests show abnormal results, like high creatine kinase levels or muscle biopsy results. This step-by-step process can take months or even years. Gender also plays a role in delays. Muscular dystrophies are more common in males, so doctors might overlook or delay testing in females. If there's no known family history of the disease, clinicians might not think to test for it early on. For families, early diagnosis is very important. It allows for earlier treatment options, better management of symptoms, and helps with family planning. Knowing early also means families can access new therapies that work best when started early. Overall, the delay happens because early symptoms are often mild or nonspecific. Initial healthcare visits may not involve specialists familiar with muscle diseases. Testing is a process that takes time, and lack of family history can make doctors less suspicious early on. Improving awareness among healthcare providers and encouraging early genetic testing can help shorten this delay and improve lives.